Welcome to the world of laboratory professions. You're about to explore some distinct roles that are quintessential to healthcare. We'll delve into phlebotomists, pathologists, and other roles, learn about their vital work, intricate tasks, and the qualifications required. Also, we'll review their respective 2023 salaries. So, buckle up, gear up for an educational ride, and let's get started. Starting off with phlebotomists, the individuals who are experts in drawing blood. These professionals are the frontline soldiers in the healthcare industry, often being the first point of contact for patients. Their primary role is to collect blood samples from patients for various medical tests and procedures. Phlebotomists require a steady hand and a calm demeanor, as they often work with patients who might be nervous or uncomfortable. In terms of compensation, the average phlebotomist earns around $30,000 a year. While this might not seem like a fortune, remember that entry requires less credentials. Typically, all that's needed to become a phlebotomist is a certificate program, which can often be completed in less than a year, and is a quick way to earn laboratory experience. But you don't have to be a phlebotomist to begin a career in the laboratory. So, if you're considering a career in the medical field and are not squeamish around needles or blood, becoming a phlebotomist could be a great first step towards a rewarding laboratory career, because phlebotomists play a vital role in patient care and quality results. Next up, we have medical laboratory technicians. These are among the unsung heroes working behind the scenes in the healthcare industry. They perform a variety of laboratory tests, which can range from simple blood tests to more complex ones like identifying bacteria or viruses. They're the ones who provide the vital data that informs the decisions of doctors and specialists. Now, when it comes to their pay scale, on average, a medical laboratory technician earns around $45,000 annually. Not too shabby for a job that requires typically just an associate's degree, wouldn't you say? But remember, this may vary depending on the region and the complexity of the tasks performed. Education-wise, most medical laboratory technicians hold an associate's degree in clinical laboratory science or medical laboratory technology. Some U.S. states also require a license or certification, so it's worth checking the specific requirements in your area. It's important to note that medical laboratory technicians perform critical testing that informs doctors' decisions. Moving on to clinical laboratory scientists. These professionals are the wizards of the medical world, transforming simple biological samples into a wealth of information. They perform a variety of complex tests, often using sophisticated equipment to detect diseases and monitor treatment effectiveness. Clinical laboratory scientists, also known as medical technologists, are the backbone of any lab operation. They interpret and report test results, often working in tandem with physicians and other healthcare providers and their laboratory co-workers to ensure the best patient care. After gaining bench experience, this degree can potentially set you towards becoming a senior clinical laboratory scientist, or a laboratory manager or director. Now let's talk about the figures. On average, these scientific maestros earn around $60,000 annually, a rewarding sum for their crucial role. And what does it take to become one? Typically, you would need a bachelor's degree in clinical laboratory science or medical technology and a certification. Some graduates also pursue a master's degree for further specialization and potential for advancement. So, the next time you get a test result, remember the clinical laboratory scientist who made it possible. Next, let's look at cytotechnologists. These are the specialists who study cells and cellular anomalies. They're the ones responsible for examining cell samples under the microscope, identifying abnormalities that might be indicative of disease, such as cancer. Their work is critical in early detection, patient diagnosis, and monitoring the effectiveness of treatment. Diving into the numbers, a cytotechnologist can expect an average annual salary in the ballpark of $70,000, though this can vary depending on experience and location. Now, you might be wondering, what does it take to become a cytotechnologist? The minimum education requirement is typically a bachelor's degree in cytotechnology or a related field. Some may also pursue further specialization through a master's degree or certification programs. In essence, cytotechnologists are the cellular detectives of the lab, their microscopic investigations providing crucial insights into the world of disease. Cytotechnologists provide crucial insights into cellular abnormalities. Now, on to histotechnologists. Histotechnologists are also among the unsung heroes of the hospital. They are the ones who take tissue samples and transform them into slides that can be examined under a microscope. They work behind the scenes, preparing the stage for doctors to diagnose diseases and plan treatments. Now, let's talk dollars and cents. The average annual salary of a histotechnologist in the United States is around $60,000. Not too shabby, right? But of course, with great pay comes great responsibility. To become a histotechnologist, you typically need at least a bachelor's degree in histotechnology or a related field. This is a profession that requires a keen eye, steady hands, and a deep understanding of human anatomy and pathology. So the next time you see a microscopic image of a tissue sample, remember the skilled histotechnologist who prepared it. Histotechnologists help us understand the bigger picture by examining the tiny details. Let's not forget about our laboratory information specialists. These professionals play an integral role within the laboratory setting, bridging the gap between technology and the clinical laboratory. Their work is crucial in managing and interpreting data generated from various laboratory tests and procedures. They are the behind-the-scenes experts who ensure that all laboratory data is correctly recorded, analyzed, and reported. This role requires a high level of precision and keen attention to detail. Their expertise contributes significantly to the accuracy of diagnosis and treatment. Now let's talk numbers. On average, a laboratory information specialist earns around $65,000 per year. This can vary depending on the region and the level of experience one has in the field. In terms of education, most laboratory information specialists hold at least a bachelor's degree in a science-related field, although additional certifications and professional experience can enhance job prospects. As many lab professionals know, laboratory information specialists ensure the smooth operation of laboratory data systems. Before we delve into the world of genetics technicians, let's take a moment to talk about the satisfaction that comes with being a lab professional. Picture a student, fresh out of college, stepping into the lab for the first time, the gleam in their eyes as they put on their lab coat, the thrill of holding their first test tube, the satisfaction of contributing to something bigger than themselves. These are the moments that define a lab professional's career, the moments that make all the hard work worth it. The late nights studying, the countless hours spent in the lab, the meticulous attention to detail, all come together when they see the impact of their work. Whether it's a successful test result, a patient's improved health, or even a groundbreaking discovery, these moments of triumph bring a smile to their faces. Being a lab professional isn't just a job, it's a calling. It's about making a difference, about improving patient outcomes, and about advancing the field of medical laboratory science. So, to all the aspiring lab professionals out there, we say this: the journey may be challenging, but the rewards are immeasurable. Next, we have genetics technicians. These pros are the unsung heroes of the genetic realm, examining genetic material in the lab. They perform tests, handle specimens, and upkeep equipment, following stringent safety protocols. Their work plays a pivotal role in the discovery of genetic disorders and studying inherited traits. Also, this profession aids in research that can trigger revolutionary medical breakthroughs. Academically, this role demands a bachelor's degree in biology or a similar field. Some jobs might require a master's degree or even a further specialization in genetics or biotechnology. In terms of earnings, they can expect to make around $50,000 annually in the US, although this fluctuates based on location and experience. Yet, the rewards factor in more than just money. They play a vital role in decoding our genetic constitution, pushing forward medical research, and offering crucial data that can guide patient care. In conclusion, genetics technicians are indispensable to the ever-evolving field of genetics, providing valuable insights that can lead to the development of new treatments and therapies. Now let's talk about doctors of clinical laboratory science, or DCLS. These individuals are leaders in the laboratory field, overseeing and leading diagnostic management teams. Their work involves interpreting complex laboratory results and making critical decisions that impact patient care. They are the bridge, connecting the lab and the medical team, translating the language of test results into actionable information for diagnoses and treatment plans. The journey to becoming a doctor of clinical laboratory science is no easy feat. It requires extensive education and training, including an undergraduate degree in a clinical laboratory science, followed by a master's degree, then a doctoral degree in clinical laboratory science, as this rigorous path ensures they are equipped with the knowledge and skills necessary to tackle the complexities of laboratory diagnostics. In terms of earnings, doctors of clinical laboratory science can expect to make a significant income, some well into the six-figure range. But beyond the financial rewards, the satisfaction comes from knowing that their work directly influences patient care and their outcomes. In conclusion, a DCLS's work may go unseen, but their impact is felt throughout the healthcare system. They play a crucial and valuable role in diagnosing and treating patients, and their work is vital to laboratory medicine. Lastly, we have clinical pathologists. These are the superheroes of the laboratory world, operating behind the scenes to make crucial diagnoses and guide treatment options for patients. A clinical pathologist's role is multifaceted. They are responsible for interpreting laboratory results, but their work doesn't stop there. They also develop new methods of testing for diseases, and they're the ones who ensure that the tests are accurate and reliable. They're detectives, innovators, and quality control experts all rolled into one. As for their earnings, clinical pathologists command a significant salary. On average, many earn well over $200,000 a year. This reflects the high level of expertise and responsibility inherent in their role. The journey to becoming a clinical pathologist is a long one, requiring extensive education and training. Firstly, an undergraduate degree in a science-related field is usually required. This is followed by a medical degree and then a residency in pathology, which can take another 4 to 5 years. Some clinical pathologists even opt for additional fellowship training in a subspecialty area. Despite the rigorous path to this profession, the rewards are substantial. Not only do clinical pathologists earn a very commendable salary into the 6 figures, and this is because they also contribute greatly to patient care by providing vital diagnostic information. In conclusion, clinical pathologists play a crucial role in diagnosing and treating patients. Their work is also often unseen, but it's absolutely vital to the essential diagnosis of a patient's pathology. So there you have it, a look into the diverse world of laboratory professions. From phlebotomists to clinical pathologists, each role plays a vital part in the world of healthcare. This is not an exhaustive list of laboratory professions by no means, but this video gives you an overall view of the opportunities to work in the exciting and investigative work of laboratory science. They all come with different educational requirements and offer a variety of annual salaries. And each of these professions contribute uniquely to our understanding and treatment of diseases. These are the unsung heroes of the medical world, working behind the scenes to keep us healthy. Remember to like, share, and subscribe for more informative videos like this one. Thanks for watching.